Dear participants, for your convenience, in the course of Zoom event, the language interpretation is enabled. In the conference webinar settings translate section, you can see two channels of communication. Due to the technical aspects, namely, Zoom system doesn't provide Ukrainian translation at some devices. The languages will be displayed in this way. German channel for Ukrainian and English channel for English. Thus, if you deliver the speech in Ukrainian, please choose the German channel. If you speak in English, choose English channel. The same rule applies to the listeners. Please choose the channel of the language you would like to hear. Thank you.
L'ho attivato. Poi c'è a destra l'iconcina, è interpretazione.
Шановні учасники, інтерфейс нашої
una
зустрічі
scelta, devi andare
переклад
sullo
українською і
schermo.
англійською мовою забезпечено.
Perché hai pure la cuffia oltre che parlare al telefono con me? Aspetta.
У панелі налаштування конференції ви можете знайти секцію «Переклад», де ви побачите два мовних канали – український, який позначено німецьким каналом, та англійський, який позначено англійським каналом. На жаль, Zoom не відображає переклад українською мовою на всіх девайсах, тому українська мова буде звучати на німецькому каналі. Mr. Ambassador, can you hear me in English? If you can hear me, please give the sign. Все, я починаю. We're about to start. Good morning, Excellencies, distinguished guests, and all the participants. We gladly welcome you at the International Online Conference, Covid-19 Pandemic in the Context of Humanitarian Crisis, East Ukrainian Sanitation and International Experience. May I remind you that this event became real thanks to the Embassy of the Sovereign Order of Malta to Ukraine in cooperation with the Embassy of Croatia, Embassy of Romania, and with the media and technical support by the GDIP Mediasentre and Swiss Institute of Cultural Diplomacy and Media Supporting Partner. The event took place over 2 days, this morning and tomorrow afternoon, in the course of which we will listen to our distinguished experts sharing their experience. Today's session will focus on the epidemiological situation in Ukraine and in particular in the east of the country. You can see the program of our event as well as the list of the participants in the in-meeting chat. Against the backdrop of severe repercussions spurred by the global pandemic, it is about to impart the new criticism and the needs that have been found in the evolution of the COVID-19 epidemic in the areas affected by the humanitarian crisis, especially in the east of Ukraine, as well as to stress measures that have been implemented and their persistent shortcomings, and to share the international experience in order to draw lessons needed and move forward to a more safe and healthy future we share. This is the purpose of our meeting. For your convenience, in the course of our Zoom event, the language interpretation is enabled. Thus, if you deliver the speech in Ukrainian, please choose German channel. If you speak in English, choose English channel. The same rule applies to listeners. Please choose the channel of the language you would like to hear. If you can hear 2 languages while speaking or listening to somebody, please mute original sound function. Follow the interpretation instructions guide in the in-meeting chat in case you have some problems. I kindly ask you to abide by the etiquette of the online meeting, not to turn on your microphone if you are not the speaker, just the raise hand function to ask your questions or use the in-meeting chat for that purpose. Please take into account that asking questions shouldn't exceed 5 minutes. Please remember that the time allocated for each speaker is limited either. For your information, the conference airs live on the YouTube. Please follow the link in the in-meeting chat to access it. In the end, we will have 2 20-minute discussion panel, so you have a good chance to ask questions to the speakers and exchange information. For now, dear guests, I would like to ask you to turn on your cameras to make the memorable photo of our event. If you have the mask, please put off the mask, and we need your attention for a minute to make the group photo.
Sorry, your microphone is on mute, please.
If someone's speaking, you're on mute.
Yeah. Okay. Thank you for reminding me. My microphone was not turned on. So I would like to pass the word to the moderator of our first session, Dr. Emmanuel Bruni, Health Cluster Coordinator from the World Health Organization Office in Ukraine. Mr. Bruni, please take the floor.
Yes, thank you very much. Good morning. Could you confirm that you hear me, please?
We can hear you on the English channel.
Okay, thank you very much. So my role will be just to moderate this very interesting discussion. I am the Health Cluster Coordinator and I work also for the World Health Organization. Today we are going to have a lot of important guests. Some of them I met them in person, some of them I met them now for the first time. So we have His Excellencies Antonio Gazzanti Pugliese di Cotrone, the Ambassador of the Sovereign Order of Malta to Ukraine. We have the Ministry of Health of Ukraine, Dr. Victor Liashko. We have the head of the UN Resident Coordinator Office in Ukraine, Mr. Denis Bezedic. We have the Deputy Head of the Office for the Coordination of Humanitarian Affairs, Mr. James Wetherill. We have the head of Unicef in Ukraine, Mrs. Lotta Slivander. We have for ICRC the head of Mrs. Florence Gillette. And finally, we have the head of Caritas Ukraine, Mr. Andrei Vaskovich. I would like to save time, and for the sake of time saving, I would like to start. Just a little reminder on the moderation. We will allow to have 2 questions after each contribution, and then for the time saving, we will keep the discussion at the end. Of course, it would be good if each questions will be coming with hand raising or with a comment in the chat, and then I will be happy to give the floor. So thanks again, and I would like to now give the floor to the ambassador. Grazie, and have a good day.
Thank you. Thank you. Can you hear me?
Well and sound. Thank
Okay.
you.
Thank you. Excellencies, authorities, distinguished speakers, dear friends, thank you very much for your participation in the video conference COVID-19 pandemic in the context of the humanitarian crisis, situation in Eastern Ukraine, and international experience, organized by the Embassy of the Sovereign Order of Malta in Ukraine. As it is well known, on 11th March 2020, the World Health Organization defined the coronavirus infection as a true world pandemic due to its high level of severity and spread, as well as a public health emergency of international importance. The situation has gradually worsened, also due to adoption of measures that are not always timely and adequate, and sometimes not respected in their practical application. Today, the whole world is affected by this pandemic. So then even countries with less invasive levels of spread cannot in any way be considered extraneous to the serious consequences threatening the rest of the planet. Recently, scientists have also discovered the development of some more aggressive variants of the virus in specific geographical areas, which have generated further concern, disorientation, and questions. but it is clear to all that this is no longer just a medical and health problem. COVID-19 has had profound repercussions also in the economic and psychosocial field. Experts of the mental health field have noted a serious increase in social isolation, people's uncertainty about present and future, fragility of human relationships, obsessive fear of contamination, loss of confidence in points of reference and sources of information, and generally speaking, the greater exposure to depressive phenomena. From another point of view, it should be remembered that the virus does not affect everyone in the same way. For many months now, we have been hearing about risk categories. These include, in the first place, the health workers who are courageously and generously trying to fight this disease. We would like to express them our biggest gratitude and support for everything what they are trying to do for us all. It should be borne in mind, however, that the categories at risk include also the elderly, people suffering from other serious illnesses, and those sections of the population that should already be considered at risk for reasons such as poverty, marginalization, ignorance, and discrimination. We realize then that the effects of the coronavirus are even more devastating when they are compounded by other pre-existing or existing problems. This happens, unfortunately, in areas affected by natural disasters or subject to conflict. Unfortunately, for many years, the east of Ukraine has been experiencing a dramatic conflict, which in addition to high numbers of victims and IDPs, has produced a serious devastation and hardship. The environmental damage, pollution of the water, the loss of basic hygienic conditions, the lack of basic services, the isolation of elderly, the deficit of the school system, the psychological damage, the division of families, the destruction of houses and public facilities, and other devastating conditions. It is truly difficult to imagine what else COVID-19 could provoke in such a harsh reality. As the experts have warned, the battle to COVID-19 is a long and complex road. It will take time, and the basic measures of social distancing, masks, and disinfection will have to be adopted for a long period. However, it will also be necessary to give adequate answers to some questions, which often arise from fear or prejudice. How was it possible to produce a vaccine in such a short time? How can we be sure of the absence of side effects? Is it or will it be compulsory to undergo vaccination? And above all, will there be sufficient availability for everyone? It is precisely this last point that is causing considerable concern. High moral authorities are making us reflect on the fact that the spread of vaccine must be inspired by criteria of justice, balance, and humanity. The pandemic will not be won by a scientific discovery, a protocol of understanding, or a bureaucratic procedure alone. The challenge we are facing is much more demanding and goes to the root of the human being. Allow me to recall the words of Pope Francis about those who, without noise, have made this suffering more bearable for their neighbors, and about those who, with a daily commitment driven by love, have reached out to those in need with gestures of solidarity and closeness. For this reason, I would like to take this opportunity to thank the Maltese Relief Service of Ukraine, along with all those who are doing their best in their context, for all their important professional work carried out throughout the country. My thoughts and thanks go to them. To conclude, the Embassy of the Sovereign Order of Malta to Ukraine has promoted the organization of this video conference with a conviction that a comparison of such high professional experiences and qualified testimonies can represent a further step in the in-depth analysis of a vast, complex, and full of different implications issue. Thank you for your attention and good work to all.
Thank you very much, Ambassador, for these opening remarks and mostly for all these questions that are really opening the discussion in terms of the important problem that needs to be faced. I think we can start this discussion and by giving the word to Dr. Victor Liasco, as by program, Deputy Minister of Health in Ukraine. Over to Dr. Liasco.
Вітаю всіх. По-перше, дозвольте подякувати за організацію такої відеоконференції. По-друге, за допомогу, яку отримує Україна від наших партнерів, в тому числі і на сході нашої країни, де, на жаль, продовжують тривати і бойові дії, і ми бачимо, знову ж таки, періодичні загострення, які, на жаль, приводять до втрати життя, людських життів, і окрім тих випадків, які вносить в наше життя і коронавірусна хвороба. Коли ми подивимось, якщо зупинитись на темі мого виступу, коли ми подивимося зараз на динаміку зареєстрованих випадків COVID-19, то вона свідчить про зниження кількості, розпочинаючи із 49-го тижня 2020 року. В нас вже з 50-го тижня 2020 року кількість осіб, що одужали, перевищує кількість нових зареєстрованих випадків. Загалом в Україні за період епідемії підтверджено лабораторно 1 мільйон 221 тисячу випадків коронавірусної хвороби. На даний момент маємо одужавших 1 мільйон 23 тисячі випадків, тобто 83% від усіх виявлених випадків. Але є і негативна сумна тенденція – це 22 тисячі 760 випадків летальних внаслідок коронавірусної хвороби. Випадки COVID-19 реєструються на території всіх регіонів України. Однак показники захворюваності мають діапазон коливань від 1000 випадків на 100 тисяч населення, наприклад, в Кіровоградській області, до 5000 на 100 тисяч населення в Чернівецькій області, з якої і розпочалась в Україні епідемія коронавірусної хвороби. Наразі летальність в нас становить чуть-чуть менше 2%, 1,9%. Це непоганий показник порівняно з світовим і загальноєвропейським показником. В той же час найвища летальність реєструється в Кіровоградській області – 3,3%, але в Кіровоградській області, знову ж таки, найменша кількість захворівших, тому і концентрація летальності, знову ж таки, в цій області найбільша. Найнижча летальність наразі фіксується в Рівненській і Черкаській областях. Щодо померлих, якщо подивитись детальну статистику, то з 22 тисяч летальних випадків 84% – це особи старше 60 років. Тому і стратегія імунопрофілактики, яка в нас має, компанія імунопрофілактики, яка має розпочатись в лютому цього року, в першу чергу направлена на медичних працівників і після цього переходить на людей старше 60 років, оскільки це найбільша група ризику в Україні. Наступний слайд. За весь період пандемії проведено в Україні вже більше 6 мільйонів досліджень методом полімеразної ланцюгової реакції, серед яких 23% виявились позитивними. В останні дні цей відсоток зменшується. Буквально завчора в нас такий відсоток був 18, але загальний 23% позитивних. І більше 3 мільйонів досліджень проведено методом імуноферментного аналізу, отримано 15% позитивних. Починаючи із 49-го тижня 2020 року, разом із захворюваністю в нас знижується і коефіцієнт позитивних результатів, які проводяться методом полімеразної ланцюгової реакції. За весь період спостереження, наприклад, у Донецькій області на підконтрольній території України було зареєстровано 44 тисячі випадків, що склало 3,6% від усіх випадків по Україні. Наразі вже одужало 90% людей, які захворіли на коронавірусну хворобу і потрапили до офіційної статистики. Померлих в Донецькій області 902 людини. Щотижнева динаміка реєстрації випадків захворювання свідчить про її зниження, в тому числі і на Донецькій області. Якщо ми поговоримо про медичних працівників, то на території Донецької області ми зафіксували 1838 випадків захворюваності на коронавірусну хворобу саме серед медичних працівників. В Луганській області ситуація відрізняється, і наразі маємо зареєстрованих 13 тисяч випадків коронавірусної хвороби, і з них 83% вже одужало, а з 397, на жаль, маємо летальних випадків. Динаміка до зниження відрізняється від Донецької, розпочалась набагато пізніше, саме після новорічних свят, і співпадає з моментом введення жорсткіших карантинних обмежень в Україні, саме другий тиждень 2021 року. Також в нас зареєстровано медичних працівників на території Луганської області, які захворіли на коронавірусну хворобу, це 1042 випадки. Коли подивитись, чи впливає коронавірусна хвороба на перетин пунктів в'їзду-виїзду з підконтрольної або з непідконтрольної на підконтрольну територію, то впродовж 2020 року кількість людей, які перетнули КПВВ, становить близько 3 мільйонів осіб. Це значно менше, ніж було, наприклад, в 2019 році. Тоді в нас 16,5 мільйонів осіб перетнуло кордони нашої держави. Відсоткове співвідношення, можете прогорнути слайд, відсоткове співвідношення осіб, які перетинали лінію на в'їзд-виїзд, майже однакове, тобто десь 50% заїжджає, 49,8% відповідно залишають територію підконтрольну Україні. Наступний слайд, там прогорніть, бо ми трошки запізнились. В кінці, наступний, можна подивитись там слайди. І ще там 2 рази, будь ласка.
Sorry, Dr. Liasco, we are afraid we don't hear you anymore.
І в кінці 2020 року Україна почала застосовувати для діагностики ковід швидкі тести для виявлення антигену, результати якого можна отримати за 10-15 хвилин. І вже в січні 2021 року розпорядженням керівника робіт ми розпочали тестувати Ми почали тестувати на КПВВ і експрес-тестами на антиген. І тепер люди, які перетинають пункти в'їзду, виїзду з непідконтрольної на підконтрольну територію, мають можливість отримати наступний доступ на підконтрольну територію. Перше, це вони на прикордонному, під час проходження паспортного контролю встановлюють додаток «Дій вдома». Після цього заходять на підконтрольну територію і в сервісній зоні розміщуються пункти тестування експрес-тестами. В разі, якщо після проведення такого тестування є негативний результат, пункт тестування передає інформацію в додаток вдома, і людина не потребуватиме ізоляції або обсервації. В разі, якщо людина не бажає там чекати на проведення тестування в сервісній зоні, вона має право проїхати впродовж 48 годин до пункту, який вона зазначила в додатку вдома для проведення там проходження ізоляції, або здати тест в приватній лабораторії, отримати позитивний або негативний результат. Негативний дозволяє припинити ізоляцію або обсервацію. І в разі, якщо в людини немає можливості встановити додаток вдома. Голови обласних адміністрацій Донецької і Луганської області створили обсерватори, в яких повинні люди відбути 14 днів для того, щоб провірити, чи не виявляються в них симптоми коронавірусної хвороби, або якщо це буде виявлено, то вони будуть отримати безоплатне лікування на території України. А якщо не будуть виявлені, то вони відпускаються і вже можуть вільно пересуватись на території підконтрольній Україні. Тому проблеми в нас існують. Сьогоднішній день в Україні пов'язані з коронавірусною хворобою, пов'язані з перетином державного кордону, пов'язані з перетином пунктів в'їзду в Донецькій, Луганській областях, а також в Автономній Республіці Крим. Але ці проблеми, на жаль, виникли через об'явлену Всесвітньою організацією охорони здоров'я пандемію коронавірусної хвороби. Щодо медичної допомоги, медична допомога надається сьогодні всім на території, хто перебуває на підконтрольній території України, безоплатно в закладах охорони здоров'я. Фінансування цих послуг здійснюється Національною службою здоров'я України і повністю покривається за рахунок державного бюджету. Матеріально-технічна база лікарень зараз порівняно набагато краще, ніж була навесні. Особливо це, знову ж таки, стосується Донецької і Луганської областей, в якій більшість лікувальних закладів обласного рівня залишились на непідконтрольній території України, і тому це потребувало від Міністерства охорони здоров'я, від обласних державних адміністрацій значних зусиль, щоб наростити спроможності матеріально-технічної бази. Сьогодні є лікарні, є медичні команди, які працюють в лікарнях, є ліжка, забезпечені киснем, для того, щоб рятувати життя українців, незалежно від того, в яких вони обставинах залишились в зв'язку з тим, що відбулася агресія держави-агресора на Україну. Сьогодні, на жаль, в нас трапився одна надзвичайна ситуація. В Запорізькій області в обласній інфекційній лікарні відбувся вибух на 5-му поверсі в реанімаційному відділенні. Загинуло 4 особи, серед них молодий лікар-реаніматолог. Зараз причини цього вибуху виясняємо. І на місці працює комісія за участі міністра охорони здоров'я. Тому ситуація як епідемічна, так і військова, так і повсякденна не дає нам спокійно реагувати на поширення коронавірусної хвороби і постійно реагуємо на різні виклики. Тому в мене все, я готовий давати відповіді на ваші запитання. І ще раз, користуючись нагодою, дякую всім, хто долучений до цієї відеоконференції.
Many thanks, Dr. Liasco, for such a comprehensive presentation. It was full of data and full of reflections. At the moment, I don't see any hands raised in the chat, and I haven't found any question in the chat. I would like just to give one more minute for anyone who wants to raise the question to Dr. Liasco.
Dear participants, please take into account that in the end we have the discussion panel, so if you don't manage to ask your questions now, you will have the time in the end. Thank you.
So I think we will keep some questions for the end, and for sake of keeping timing in time, I would like to go ahead with the next contribution. Again, thanking Dr. Liasco for the presentation. And I would like to give the floor now to Mr. Denis Bezedic, Head of Office of the UN Resident Coordination in Ukraine. Mr. Bezedic, are you online?
Yes, I'm online. I can hear you loud and clear. Can you hear me?
Yes, we do hear you. Good morning and welcome.
Thank you, Manuela. Excellencies, ladies and gentlemen, on behalf of the United Nations in Ukraine and the resident coordinator, Ms. Osnat Dobrani, allow me to thank the Sovereign Military Order of Malta and His Excellency Mr. Antonio Gazzanti Pugliesi de Cotroni, Ambassador of the Order to Ukraine, for organizing this international online conference and for inviting the United Nations to participate. Sincerest thanks also to Deputy Minister of Health, Victor Rashko, for your presentation on the government's efforts to address the challenges that this pandemic has caused, which, due to the ongoing conflict, disproportionately affect the East. Most of my colleagues from Unicef, WHO, and OCHA will soon address you all on their respective areas of expertise and engagement. Allow me to convey several key messages that the UN Secretary General has globally, and we here at the country level, have been reiterating. Namely, strengthening the call for a global ceasefire. Second, reiterating our concerns about the effects of the pandemic on humanitarian action and human rights. Third, outlining key action areas that must be addressed to tackle the socioeconomic impact of COVID-19. And lastly, vaccine rollout and access, as well as maintenance of ongoing pandemic measures and the need for ongoing implementation of healthcare reforms. First, the global ceasefire. As the pandemic began to take the world by storm last year, the Secretary General appealed for a global ceasefire to allow us to focus together on the true fight, the virus. We commend President Zelensky's and the government's positive response to this call, which we hope will be maintained, thus serving as the bedrock for further efforts to resolve the conflict in the East. At the same time, we remain very concerned by the effects of the pandemic on the most vulnerable populations living in the conflict-affected areas on both sides of the contact line. Freedom of movement remains limited, particularly through the entry-exit checkpoints. While restrictions due to COVID-19 are to be expected, their stringency has reduced, as the Deputy Minister has rightly pointed out, crossings by staggering almost 95% compared to pre-pandemic levels. The vulnerable, including low-skilled and seasonal workers, the elderly, the disabled, amongst others, suffer the most. It is unfortunate that new service centers established at the crossing points are being sorely underused. Following her recent visit to Donetsk and Luhansk regions, the RC underscored that unimpeded access for humanitarian actors is necessary to ensure that critical aid reaches the estimated 1.7 million people that need it most. Solutions must be found together to allow for greater freedom of movement across the contact line, particularly now in Luhansk region, not under government control. Humanitarian operations must be allowed to continue in accordance with humanitarian principles and to allow international actors to effectively fulfill their mandates. Today, the Office for Coordination of Humanitarian Affairs, OCHA, will elaborate further on the impact of COVID-19 on the humanitarian situation and outline the humanitarian response plan. In addition to the humanitarian cost of the pandemic, there has also been a negative socioeconomic impact on Ukraine, including in the East. In this vein, we have conducted a thorough analysis of the social economic impact of COVID-19 and formulated a response plan on how to counter the pandemic's impact. This plan is based on 5 pillars. First, maintaining health services and systems. Second, protecting people through social safeguards and basic services. Third, securing jobs, SMEs and informal workers. Fourth, facilitating macroeconomic response and multilateral collaboration. And fifth, supporting social cohesion and community resilience. The plan, which is available online, has been welcomed by the Ukrainian government and development partners. The plan will guide the UN's development assistance programming, and we are convinced that its implementation will significantly help the people of this country. Finally, a couple of words on the vaccine. The UN fully supports vaccinations as an effective tool to prevent disease, and therefore welcomes recent developments whereby several COVID-19 vaccines have been, or will soon be made, available. However, these new vaccines do not free us from the need to strictly adhere to ongoing public health measures already in place to combat the pandemic. They must remain in place. We also warn against the politicization of the rollout of the vaccines, or vaccine nationalism, and instead underline the importance of robust preparedness in vaccine deployment, including a public information and education campaign to build trust amongst the population for the endeavor. At the same time, we should not lose sight of ongoing efforts at healthcare reform and combating other diseases. Therefore, routine immunizations must not be neglected. Catch-up efforts are required, in particular for children who may have missed such routine inoculations since the beginning of the COVID-19 pandemic. Our agencies, notably Unicef and WHO, stand ready to continue providing support in this area. In this conference, the former will present on the impact of the virus on children, and the latter will update you on the epidemiological situation in eastern Ukraine. Let me conclude by emphasizing that the UN family of agencies, funds, and programs in Ukraine stand in solidarity with its citizens and will continue to work with the government and development partners jointly to put in place a practical, forward-looking solutions to address the pandemic. Once again, I thank you, Your Excellency, for inviting the UN to participate in this important event.
Many thanks, Mr. Besedic, for first of all, for having been exactly in time, and also for having brought the discussion not only on the epidemiological and health-related aspects of COVID, but also on the impacts and on the UN actions and plans for the next year, bringing also messages from the Secretary General. I don't see at the moment questions for you. I'm sure that there will be in the next minutes. So we will proceed with the next contribution, and I will call on the floor Mr. James Wetherell from the United Nations Office of the Coordination of Humanitarian Affairs. Mr. James, are you online?
Thank you, Emanuele. Thank you.
Good morning. Please,
good morning.
The floor is yours.
Thank you very much. I'd like to thank the Sovereign Order of Malta for inviting OCHA to be present today on this panel. And I'd like to thank all of the participants. I see that there's quite a broad range of people that are participating today, and it shows the level of interest and importance of this issue. The Office for the Coordination of Humanitarian Affairs is an office that, as it sounds from the name, we coordinate the assistance, and we work together with the humanitarian partners to identify the priority needs and the plan of response. And we work on a regular basis with all partners to understand what the situation is, to try to identify the best way to respond to it. At the start of 2020, we had hoped that we would see a reduction in the overall needs as the economy was projected to be improving through the year, but obviously the impact of the COVID-19 pandemic has drastically reversed the projections that we had expected at the beginning of the year. Unfortunately, when we look into 2021, from the humanitarian side, we do not see prospects for much of an improvement during the course of this year. In fact, it's likely the situation will remain as dire and as difficult as it was in 2020, as it will take at least this entire year to get through the COVID-19 pandemic for the rollout of vaccines, and we expect it to take at least into 2022 for the majority of the population to receive vaccinations, and if not longer. The impact on Eastern Ukraine, on the oblasts of Donetsk and Luhansk, has been quite severe. Obviously, the COVID crisis has impacted across Ukraine, but in the conflict-affected areas, those people who have already been made very vulnerable by the years, the 7 years of the conflict, have very limited coping capacity to deal with the additional burdens created by the crisis. The biggest impact really has come from the closure of the contact line. As Dennis has already mentioned, since March last year, the contact line has been largely closed, with very, very few people crossing the ECPs. Over that period, we saw about a 97% reduction between March and January of this year. And in fact, if you dig into the numbers a bit more, it's actually even worse for the residents of the non-government controlled areas of Donetsk Oblast. Because if you take, for example, the figures for just December alone, where we saw a total of 48,000 people that crossed the contact line, this is a reduction from the 1.1 to 1.2 million people that were seen in December 2019. That's a 95% reduction. But of the people that were crossing, only 1,500 were coming from Donetsk, and the rest were coming from Luhansk. And that shows that virtually more than 99% of the people that were regularly crossing from Donetsk, the non-government controlled areas of Donetsk, have not been able to cross into government controlled areas to access their pensions, to access administrative services, to do vital things like register the birth of children, register the death of family members, but also to visit family and relatives, because of course this is one area where families are resident on both sides of the contact line and have been further divided from the last now 10 months, or more than 10 months of the closure, meaning that virtually nobody has the ability to cross. There are some ways that people have been able to travel around through Russia, but this is a much more expensive way to go, meaning that only those with more means are able to do that. And when we speak of the most vulnerable population that we're looking at to assist that have been impacted by the crisis, they do not have the ability to do this. One of the most vulnerable groups is the elderly. As you are probably aware, the crisis in Ukraine, the humanitarian crisis, is what we could consider the oldest crisis in the world. In many crises in, say, in Syria or in Somalia, you see about 5% of the people in need as being elderly. Well, in Ukraine, of the 3.4 million people that we've identified as being in need of humanitarian assistance, about 40% are elderly. This is disproportionately high. I mean, the elderly are extra vulnerable, especially when we consider in these areas, there's been, especially close to the contact line, quite a bit of movement of populations away for those people who have means that are younger, leaving elderly to defend for themselves, to try to identify ways to survive, meaning they're ever more reliant on pensions that they have earned over their lifetime. And those people who are on the non-government controlled side, having no access to these pensions means that the impact has been devastating. Of course, in terms of our humanitarian response, when we look at the total number of people in need, the 3.4 million people, we are targeting about 1.9 million people. We don't have the funding or the capacity to address all of the needs that are there. But unfortunately, because of our access constraints into the non-government controlled areas, the proportion of people we are able to target that are in need in the non-government controlled areas is significantly lower than the proportion in the government controlled areas. For example, of the 3.4 million people in need, we're targeting 1.9 million people under the 2021 humanitarian response plan. Of those 1.9 million people, about 1.13 million are in the government controlled areas and only 770,000 in the non-government controlled areas. This means of the people in need, we are only able to target 45% of those in the non-government controlled areas, whereas in the government controlled side, we're able to target 75%. And this is to do with our ability to establish and conduct humanitarian assistance programming in the non-government controlled areas. So when we speak about our access constraints, we have access constraints for the humanitarian response, but we also have access constraints from the population itself being able to go. And because of these access constraints, we are seeing a humanitarian impact on the population. The impact on the population or in our humanitarian response has also been made more difficult through problems we've been facing, for example, with the import of humanitarian assistance into Ukraine related to COVID-19. Shortly after the crisis began, expedited procedures for the clearance and the registration of cargo were put into place, and they worked very, very well to enable the humanitarian responders to import cargo on an expedited basis. Unfortunately, these procedures were lifted or removed in August of 2020 because of administrative problems with the orders that were concerning the import. And we've been working for the last few months together with the government, with the Ministry of Social Policy, to arrange for an return to the expedited import of essential COVID-19 response materials. I think we've received a very good coordination and cooperation from the government of Ukraine, and I think we are almost at the point where we are able to return to an expedited import and clearance, but this will greatly impact the ability for humanitarian responders to provide assistance to people on both sides of the contact line. I would like to draw attention to an area that's a new concern. As you are probably all very well aware, in the elections that were held last year, in 18 hromadas along the contact line, the elections were not able to be held. And in these hromadas, they continue to be under civil military administration. Unfortunately, since the beginning of 2021, these 18 hromadas have not had access to their their 2021 budget to be able to provide the regular social services or services that a government provides, from education to health to other services that are electricity and heating that are essential for the population to survive. So I just wanted to draw your attention to issues that need to be addressed. The problems at this stage appears to be the lack of the appointment of civil administrators in these localities. And once that is done, they will have access to their budgets for 2021. And so we're hopeful that this will be resolved in the coming weeks, so that we can ensure that what is actually essentially a governance problem on the development side will be able to be resolved and not create further humanitarian hardships for the populations that are so close to the contact line. I think Dennis referred to the new service centers that have been installed at the ECPs. These are welcome. The services that people crossing the contact line from the non-government controlled side are accessing need to be very readily accessible. But of course, as we've already said, without a population crossing the contact line, all the services and all the systems put in place will not be able to reach the population most in need. So we call on all actors on all sides to develop mechanisms to ensure that the population is able to cross to receive the services and access the pensions that they have earned in a safe way, in accordance with WHO standards for the movement of people across the contact line, to ensure that the population will not be further separated from their families and will be able to access the assistance that they need. I think at this point I will leave it there. Just to say that the humanitarian response plan for 2021 is asking for 168 million to address the humanitarian needs. The humanitarian response plan in 2020 was asking for 205 million. This is a scale up in response to the impact of COVID. It was relatively well funded at 62%, and so we thank all of the donors and member states who have contributed to the response, and we hope that we will receive similar support for the humanitarian response in 2021. Thank you very much.
Many thanks, James, also for the daily collaboration that there is also with all the partners from OSHA and coordination on the response. And your presentation was really comprehensive, and it was really also a realistic approach, which I think is very important. And I think I don't see other questions at the moment. I'm sure there will be more in the discussion further. And so I would like to give the floor to another important partner in this response, and which is Unicef. Of course, is represented here by Mrs. Lotta Silwander. I would like to have to confirm that she can hear us.
I am. Yeah, I can hear you.
Already saw her.
Yeah.
Good morning, Lotta.
Good morning. And thank you, Ambassador Pugliese Cotronet, for inviting Unicef to speak at this event. And good morning, colleagues, ambassadors, and government officials. Let me first say that, just like I think the previous speakers have said, that the situation during the time of COVID has really exacerbated the situation for children in the East on both sides of the contact line. And despite the fact that we had, still have, I assume, a ceasefire, the many breaches of that ceasefire and the continued impact of COVID-19 has had a severe effect on children's situation on both sides of the contact line, and particularly those who live very close to the contact line. Despite the ceasefire, we have seen a lot or continued loss of lives and continued civilian casualties, including children finding unexploded ordnances or stepping on landmines, etc., etc. And we saw a dip for a while, but then it all came back. It's, I think, quite easy to say we've all been affected by COVID-19. And the double burden of the conflict and the COVID-19 makes the situation in both the government-controlled or the non-government-controlled areas in the East very difficult at the moment. And then on top of that, now we have the winter situation. Let me start first with saying that UNICEF has looked at the poverty situation in the country in general, and we see a very high increase in poverty incidents all over the country, but in particular in the East. And we believe that the number or percentage of children living in poverty have gone from somewhere 36% to more than 50% children living in poverty. And this is not using European standards or anything like that. This is using Ukraine's own definition of poverty. And as you know, people in the East and near the contact line on both sides have difficulties making ends meet, have difficulties finding jobs, have difficulties to find transport due to, well, either lack of transport or the lack of roads and bridges, etc. We've had, over the years, a number of schools destroyed. We've had attacks on water infrastructure. We see a lot of health clinics, hospitals, etc., also having been attacked and destroyed, or services being depleted due to the lack of access and staffing. So that was the situation even before COVID entered the stage in the East. And now, on top of that, we have COVID. And so because of the additional economic burden of COVID, poverty has increased in general in the East. But we do see that there is an increased number of children living in poverty as compared to the number of adults living in poverty. So families with many children, or at least one child, are more likely to fall into poverty, especially in this situation of COVID, where jobs are scarce and opportunities few. So let me talk about a few of the specifics when it comes to what UNICEF is doing, and particularly about how this has affected children. And so if we start talking about health issues, I already said that a lot of clinics, hospitals, etc., have been under attack over the years and have had difficulties maintaining services because of this. And for UNICEF, it's maybe on top of the highest on our agenda is to make sure that maternal services are continued, meaning mothers who are expecting a baby or just had a baby can deliver and spend time in a safe space that can give them good services. We also are very cognizant of the importance of routine vaccinations, such as measles, diphtheria, polio, etc., that every child should have. And we have struggled to ensure that mothers along the contact line and on both sides in the East can access maternal health care services. Some mothers have to travel hours along difficult and sometimes dangerous roads because of landmines and unexploded ordnances to get to a clinic where they can deliver a baby. We have also seen a drastic decrease in routine vaccinations, which then sort of sends an alarm bell to the possible local epidemics of, let's say, measles in a year or two. So when it comes to particularly the situation around COVID and health, especially the Luhansk Oblast on both sides of the contact line is a poor region. and generally struggling to provide healthcare for its population. And that also has been exacerbated by COVID. So we have seen a lot of hospitals that have been COVID designated in both Luhansk and Donetsk on both sides, being unable to supply oxygen, for example, being unable to provide the kind of medical treatment that COVID patients deserve. Although children are less affected, there are still children who are who have comorbidities and who become sick in COVID, and they have not been able to access the kind of treatment that they should have had. I'm not going to go in detail what we have done, but we have quite excessively provided oxygenators and other medical equipment, such as also protective clothing, to many hospitals and clinics in both Donetsk and Luhansk. One issue that is a big issue on both sides is access to ambulances and access to safe ambulances with trained staff. And this again has not necessarily been available, and it can sometimes take days before an ambulance arrives, if it arrives at all. I wanted also to maybe mention a little quickly while I'm on health issues on the vaccine. So Unicef, together with WHO, is part of an initiative called COVAX. And COVAX is put together to ensure that there is a sort of equal distribution of COVID vaccines across the globe, but also within a country. So we are currently very close to bringing in the first doses of vaccines to the country that will go to health workers primarily, so that they can continue treating those who are sick. And we're talking about roughly 118,000 doses at that moment, which will come within a few weeks. And this is a story to be continued, but and I think you will hear more from my WHO colleague on the vaccine in general. What I want to continue with quickly is the water and sanitation situation in the East. So first of all, for those of you who don't know, most of the water in both the government-controlled areas and the non-government controlled areas in the East come from one source only, a river that flows north of the non-government controlled areas. The water infrastructure is very old and needs constant repair. And on top of that, of course, there is continued attacks on water infrastructures. There is placement of landmines in pipes and waterways, etc. So there is a constant, battle to ensure that populations of both sides actually continue to get water. And now we're not only talking about drinking water, we're talking about water for heating, for example, because many people in this region rely on heating for, on waterborne hot water for heating in the winter. And so since sanitation is such an essential part of the whole response to COVID, this has also been a very important focus of ours to ensure, continue ensuring that people actually have access to water so they can continue washing hands and keeping themselves clean to possibly avoid the virus. I'll quickly go over to education. And education, as you know, children were basically left to continue education from home at the beginning of last year, from March on. And this had a very big impact on children in the East, especially close to the contact line, where often there is no internet availability, where families live in poverty and therefore cannot afford Wi-Fi, even if it's there, cannot afford devices that children can work from home on. And therefore the children were unable to follow the online education that many schools changed into. And the effect here is that we see a lot of children basically not accessing education at all during last year. And we also see a frighteningly big number of dropouts, especially among boys in the East. And this is, of course, a very concerning thing, and it's a long-term effect that the COVID pandemic will have on children. We have also, through the education system and through those teachers who are still active and sort of functioning, done a lot of infotainment around the COVID, how to protect yourself, what it is, why you should keep a physical distance, why you should wash your hands, why you should wear a mask, etc. Lastly, I also want to mention issues around protecting children from abuse and exploitation. And we have seen, and you probably heard, that there is a drastic increase in violence against women in Ukraine and actually in the world. But that also includes violence against children, and physical violence, psychological violence, and sexual violence. And we have reports of very high numbers of physical violence against children in households in the East. And this is probably because of the high psychological tension in families when they have to self-isolate, when they can't move around, when the economic pressure on the families is great, and so on. Another issue that we were confronted with at the beginning of the epidemic was that a number of so-called boarding schools or homes for disabled or orphaned children were closed down. So all over the country, about 42,000 children were suddenly sent home without any sort of previous preparation. And a number of thousands of children in the East were also sent home, many of them to families that were not prepared to take them, could not afford to take them, and families who also did not know how to care for the children that were sent home from these homes or so-called boarding schools. And this constituted a big challenge, both for the Oblast's social services and for Unicef to counteract this. And this was all a sort of backlash of the COVID pandemic and the thought that homes like these were dangerous for children, and therefore the children should be sent home. So as you can hear, there have been many unexpected consequences on children of the pandemic. And we continue looking at this and being part of the humanitarian family, so to speak, in Ukraine. We continue to respond to the best of our ability. Thank you very much.
Thank you very much, Lotta and Unicef, for such a structured presentation in an excellent way, starting from child perspective in health, but then touching so many important areas, of course, vaccination and immunization, but also WASH, education, and finally, the importance of violence in terms of action against violence, of course. I don't see questions at the moment, and I think we could give the floor now to the next important contributor, which is, of course, the International Committee of the Red Cross, represented here by Mrs. Florence Gillette. Are you here with us, Mrs. Florence Gillette?
Yes, I'm here with you. Good morning. Do you hear me?
We are not still able to hear you.
You cannot hear me? Do you hear me now? Because I'm seeing my mic is working.
We can hear you.
Okay, yeah, okay.
We
apparently, some people hear me and some don't. Hello?
Looks like there is a...
Miss Florence, you are heard on the English channel.
Okay, so can you explain, how do I switch channel? Sorry, I don't, interpretation
Please
English.
follow
Okay,
the translation function and choose the channel of the language you would like to.
okay, do you hear me now?
Channel.
Yes, we do
can
hear you now.
Sorry,
Thank you very much.
Thank you very much. So, Your Excellencies and Your Excellency Ambassador Pugliese, but many thanks for the Order of Malta for convening such an audience to discuss a matter that is essential to all of you globally today, for all of us globally today. I will come back on quite a number of points that have been covered by the three speakers before me, because so I'll try not to repeat too much, and maybe to highlight and give additional perspective. Talking from the situation as we see it on either side of the line of contact, in Donetsk and Lugansk region, but also of course in the non-government controlled areas where I was myself also in the last 2 weeks. The humanitarian situation in eastern Ukraine was not stabilized when the pandemic occurred, and the pandemic affected this humanitarian situation dearly, and in some cases put us backwards. So we lost, and when I say we, the humanitarian efforts of many years were lost even in some cases. The pandemic, for instance, affected dearly the health system on either side of the line of contact, a health system that had to struggle to adapt to new needs and new constraints facing an unknown disease. We saw several hospitals that were partially or fully put in isolation due to issues in containing the infection that spread among their staff. And they required a significant amount of support and equipment that they still do require, and that in cases, in spite of the support they receive from the government of Ukraine, from private donors in Ukraine and from the international community, we still see that they are deeply affected and struggle to cover other needs beyond the COVID-19. Indeed, the pandemic created a pressure on the whole delivery of health, but it also created a fear to move, to attend medical care, and some of the restriction of movement also affected the capacity of people to reach that medical care. And this affected the quality, quantity of care, but also the prevention for many pathologies, including the non-communicable disease, severe pathologies such as cancer, tuberculosis, and TB, HIV. And I think it's quite important to understand that beyond the direct impact of COVID, we've got a huge impact on health that is still felt. As Lotta said, water still has its challenges. We have, for instance, the main and almost sole water delivery company in Donetsk region on either side of the line of contact. That has seen its whole infrastructure split in two, more than infrastructure, its capacity. Today, quite a number of repairs are affected by the fact that the equipment cannot cross the line of contact to be repaired in the main workshop of Voda Donbassa. We have issue with technician engineers that cannot cross the line of contact. We have issues in terms of the quality of the water testing that is affected. So there is still a quite dear impact, and it's going to continue. Many households who had a chance to build back a new livelihood in the last few years have seen their economic activities affected by the necessary sanitary measures, in particular in the first months of the pandemic. And all households face sharp price increases and shortage of essential goods, in particular in the first 3 months. But this was a big hit on the household economy of all those households. Education, as mentioned also by Lotta, was deeply affected. And I would say that it raises a need. It raises the importance to respond to a need, which is a need to improve digital access throughout the territory. For instance, we have been able to assist some schools, some students and some teachers to access digital tools in the beginning of the pandemic. But we also realized that first the need was huge, but primarily there was an issue of coverage with no access to the internet. We could work with the local education system to find alternative system on either side of the line of contact. For instance, we worked through the TV channels for some programs on the government side, including on mild risk education with the schools. Or we had to actually supply paper and photocopy machine so that there could be a home delivery of courses to continue the education. And that is, just an alternate solution, but really, I think that there is a real need to look at access to digital means to the population, including in remote areas and close to the line of contact and on either side of that line of contact. But most striking, and I would say for us, one of the major issue as being the line of contact and the crossing of the line of contact. As mentioned, the line of contact has long broken family and social networks that are essential for survival. They are essential because they are essential elements of mental health, but they are also essential elements of solidarity, of support to family members. And that was already affected before the COVID. Yes, there was quite a number of people crossing the line of contact, but we had seen a big decrease in the capacity of adult children to care for their older parents, for instance, and on the frequency they could do it. Now, what we see is that we have people who haven't seen each other for now close to 11 months, and next month we will be at 12 months. You've got people who are 80, 85 years old who cannot repair, the broken roof, the broken tap, and that makes their life extremely difficult, who are living alone, and this isolation is very difficult. And I'm taking the examples of older people, but this also affects children who are disconnected at times from their parents or their grandparents, but we also see children separated from their grandparents. We also see a dear impact on the economic life. A lot of households were surviving by, I would say, petty trading across the line of contact, and this has largely stopped. COVID really made the line of contact a worse issue than it was, and it has now become, to a large extent, a fortified line of separation. James gave us some figures, but just to get an idea. In Lugansk, only 25% of the people who were crossing a year ago are crossing. It's still 25%, but it's only 25%. So it means 75% are not. In Donetsk, only 0.3% are crossing. I was at Olenovka on the NGCS side 2 weeks ago, and I could see 5 cars waiting to cross the line of contact on the day it was open. How often did I cross that line of contact before, where you saw huge queues that had also, issues because people had to wait, but it's just another world, and it's a real problem. Those crossings have happened after significant periods of negotiation, months of negotiations, or lack of negotiation at the beginning. We ended up in a situation where we had to go and rescue, as ICRC, older ladies who got stuck in the gray zone because of the lack of communication between the sides. And those ladies had to spend, to stay overnight by 35 degrees in an area with absolutely nothing. And we really think that this matter has to be put very high on the agenda. It is important to have good communication and coordination on this crossing of the line of contact. Today, there are mechanisms in place. They are largely insufficient. we have been only able to help a very small number of people. We have helped last year 51 people physically to cross the line of contact, and have been allowed only to facilitate the crossing of children who were unaccompanied because they lost their caretaker, or of a disabled person in a very, very dire situation. And a few mortal remains that were to go to their families to be buried. Sanitary measures are important, they are essential, but they need to factor in the essential needs of those who should cross, and whether they are isolated, vulnerable individuals, because they need urgent life-saving health care, and we do have quite a number like that, because they need to bury a relative. And it's it should be essential that those in charge don't make it dependent on having an unaffordable smartphone, having the right connections, or having enough money to go around through the Russian Federation. Because the reality is that if you have means today, you can cross the line of contact or you can go around. But if you're a vulnerable person, so those who are really in need of crossing the line, you cannot. Now, let me come very briefly on the vaccines, which are going to be possibly one of the elements to bring us to the way out of this pandemic. They are an essential block. They are another block. They are not the only block that is necessary. I think everybody insisted well enough that we need to maintain other prevention measures in place. We need to continue all to reinforce the health response through many ways, including provision of oxygen concentrator, PPE, but also essential drugs, and infrastructure support to hospitals. Vaccines should not be politicized. The rollout of vaccines should strictly adhere to the principle of impartiality, prioritizing those who need it most. And I think this is a message to all. It's not just a message for Ukraine, it's not a message to all the stakeholders in this conflict, but it is particularly to the stakeholders in this conflict in our case, because we've seen the politicization of many humanitarian needs in the past. Vaccines should also not be used as an excuse to further restrict movements. And I think that's something we have to be careful already. We see what we hear in other places around the world. And we have to be very careful. The rollout of vaccines in Ukraine, and even more so in Eastern Ukraine, is going to take a long time. We are very far from seeing a full rollout, and there will be resistance. And we need to continue to find ways to allow people to go on with their life, including in terms of family links, social links, economic links, and access to all basic services in spite of that. It is essential that all, and when I say all, it's all those who are attending this conference, but also all the sides to the conflict and all those who are influencing the sides to the conflict, work together beyond political and conflict divide to ensure a fair deployment of the vaccine, a sustained effort to the health response, and for those who are sick, and a sustained response and coordinated response to ensure solid prevention measures. Thank you very much.
Many thanks, Florence, for having given us a picture of what's happening, and mostly also what are the action needed. I still don't see questions, and I would like to give the floor to the next contributor, Mr. Andrei Vaskovich from Caritas Ukraine.
Thank you. I would like to thank the organizers of this panel, this very important panel, to discuss the impact of COVID-19 on the humanitarian situation, especially also in the eastern part of the country. As a national NGO, we of course have the whole country in sight and see the deteriorating situation through the COVID-19 pandemic in Ukraine in different fields, especially in the social field. We see new categories of needy people who have the need of support, like returnees, former labor migrants who came back to Ukraine and now actually are not secured in the social systems of this country. Concerning the COVID-19 pandemic, Caritas Ukraine very early started to focus on this problem and rebuild their engagement in our humanitarian aid programs. First, we had the possibility to concentrate on distributing medical equipment and PPE for institutions, also implementing partners for different EU countries, especially to amalgamated humadas in Ukraine. And also help to build up programs in Eastern Ukraine concerning the protection of people in the buffer zone. But lately, we actually came to the understanding that COVID-19 shouldn't be only different projects which we will implement, but should be a cross-cutting issue in all our projects, and we remodeled our programs according to this concept. We see the impact on the people in Ukraine generally. Also, but one indicator which is very important for me. In the 90s, we had in Ukraine programs from soup kitchens to distribute food to needy people. Later on, we could build up social services for affected people. But now we are coming back to the need to distribute food in different areas of Ukraine. It means COVID-19 had enormous impact on the people, that people cannot afford anymore to buy the food they need to secure their families with food. And this is for me a very important indicator where we have to really think what we can do to have no hunger in Ukraine. We work together with church structures around Ukraine, also to build up a system of something like food banks to distribute, to collect food in the parishes and distribute it to the needy people. In the East, we have, of course, worked in distributing basic needs to the affected people. And we see, of course, the big problems there also concerning the access to the people in the buffer zone, but also, of course, the access to the non-governmental controlled areas. And I think this is a discussion we will have to really continue in the humanitarian community to get this access. Generally, I would like to mention one thing which is very important for an organization like Caritas. We, of course, concentrate now on the distribution of humanitarian aid, following the concepts of humanitarian aid, but we see also the need to develop better social services and ensure the people that they have access to social and effective social services and effective healthcare services. That's a very important point, especially in the buffer zone, where this is not guaranteed to the people, and we have to do much more to concentrate on providing services to the people and guaranteeing access to these services. Generally, Caritas Ukraine, who is working in the whole country, sees big challenges also in the new year, especially also having in mind last year's many crises which we had to face, because the pandemic in Ukraine hit a country which already has several crises. Last year, there were the impact of the war, of course, as one big crisis. Then we had the flood in Western Ukraine and the wildfires in Eastern Ukraine. So we had a country with many challenges and not enough resources to meet them all. I would like to leave it with that, because I see that the time is running, and I think it would be important that there will be also some questions and some discussions in our panel.
Many thanks, Mr. Vaskovits, for having saved some precious time, because this will be definitely used for discussion. But also I wanted to congratulate for the presentation that was also having a looking forward kind of approach. And I would like to open the floor for questions now, kindly asking to the 68 participants that we are really proud to have to this call. Before there were also 76. So it's really, it looks like it's a very well participated call, to ask to raise their hands if they know how to do it through the reactions that is underneath their browser, or to write and book questions on the chat. Over to questions. I would like maybe to break the ice with one question, and also I think that we might also ask to our panel members to ask each other questions if they feel like, because this is absolutely an opportunity to be together and to discuss.
Can you hear me?
Yes, I can.
Yes, I would like to take this occasion, this moment of lack of question, to thank all the speakers of this panel, Deputy Minister of Health of Ukraine and the other speakers for their interventions. Very interesting, very constructive. I think that we have heard the highest level of knowledge of the problematics which are in the eastern part of the country, from very professional international organizations. We have seen different perspectives. The conflict, first of all, with all the consequences in terms of economics, in terms of logistics, in terms of poverty, in terms of movements. We have seen also the difference between different territories, government-controlled areas, no government-controlled areas. We have seen the problem to realize a plan to spread the vaccine in this context. But I think that simultaneously we have seen the necessity to continue and to maintain a common effort to face this challenge. I think that only with a common effort, local, domestic, and international effort, with obviously a continuous coordination with the Ukrainian authorities, central and local authorities, we can think to face really this challenge. I would like also to underline that in addition to the agencies of the United Nations, International Red Cross, Caritas, in Ukraine, there are many other structures which are working in the eastern part. I mentioned the Malteser, our emergency agency of the Sovereign Order of Malta, but there is also the network of the churches, Ukrainian churches, Catholic and Orthodox churches. And there are many other important associations which are working together in the eastern part of the country. So I think that it is important to have a moment like this in which it is possible to realize an exchange of information and to continue, I repeat, in this common effort, international effort, which is made also by the so-called humanitarian diplomacy. I repeat, it is necessary to continue in an international common diplomatic effort to face this challenge. Thank you.
Thank you very much, Excellency, for this important resume of. I would like to ask if there are still, I think we should have still some minutes for some questions if there are. Maybe I think it would be good just to ask to, at least from my point of view as health cluster coordinator, it would be good to know from the two NGOs, representative international and national, so from ICRC and from Caritas, if they have a kind of also idea of what could be exactly in 1 year in terms of the non-direct health COVID impact that they were discussing, because I think Andriy Vaskovits was raising an important point also on this. Over to them.
I can just say one thing. Actually, what we have to have in Ukraine is a continued discussion on the social policies and also on health policies. And I think that COVID-19 brought into the attention this factor. You know, we see these discussions in other countries, and we have to really look into our systems, what we have and how we can develop them, and put much more resources and useful resources, but also a big discussion on the social prospect of Ukraine, what social system we would like to have in Ukraine, how to build it, and also what healthcare system we have in Ukraine and how to develop it. This is one of the lessons we can learn from COVID-19, and actually we are coming here to a point where the Ukrainian political elite has to really focus on a question which they not focused in the past, the social system of this country, to make it a social system which is built, in my idea, on a subsidiary system, and not on a system which was developed from the old Soviet system as a centralized system. So I think there's a lot of discussions where the civil society can take part, and also the international community can help to further such a discussion.
Many thanks. Just maybe another question or two. I think we are getting almost also out of time, but it's still good to hear some other comments. Okay, I don't see any questions and any hand raised, and looks like actually we had been going through several perspectives, points of view, and mostly a lot of information that is being still sent to our brains, and that's very important. So I think we can maybe tentatively try to close this initial session and to look at the one of tomorrow. On my personal side, I want to thank the embassy, His Excellencies, and all the participants for having given me the opportunity to be a facilitator. And if there is no other questions and other contribution, I leave the floor back to the organizer just to conclude this very interesting section. Thanks again.
Thank you very much. Mr. Bruni, thank you very much for such a detailed moderation, such a perfect representation. And let me make the small note. As soon as our conference successfully draws to the close, I would like, on behalf of the organizers and especially on the Directorate General for Rendering Services to Diplomatic Missions, we would like to thank everyone for the active participation in this exhilarating event, and we are sure that it's only the start of our discussion on the global level to be continued on the different topics concerning the political, the humanitarian, the societal challenges we face nowadays. So we hope that it's only the start for us to trigger more contemplations on this topic. Thank you very much. I would also like to note that tomorrow the conference starts at 2 p.m. In the Kyiv time, and the link is different. Please take it into account. You can find the link to this event tomorrow in the announcement you received. Tomorrow we will delve into the international practices of effective epidemic measures and information exchange and discuss the implementation of COVID-19 vaccination in Ukraine, developing possible future strategies. To make this remarkable event even more memorable, we would like to suggest making a group photo. Maybe some more people have joined us now, so I would kindly ask you to turn on your cameras and put on your mask if you have them to make the group photo. If everybody is ready, we're gonna to make the screen. Please smile. Да, все. Thank you very much. We will share the photos on our official sites, and you can see them in the meeting chat to follow the links to find out more about the organizers. And for now, I would like to wish you the nice day and let these invaluable insights and experience we gained today be a beacon of success for you and for the further cultural and diplomatic achievements. Thanks to everyone.
Thank you.
Thank you, Dr. Bruni.
Grazie a lei, eccellenza.
Grande moderatore.
Ma insomma, abbiamo fatto bene così.
Complimenti, complimenti. Grazie ancora.
Ringrazio, a domani.
Ciao a tutti,
domani.
arrivederci.
Ciao.
Bye bye.